The President of the Republic of Kenya, Dr. William Samoei Ruto, Your Excellency the Deputy President, my party leader, Excellency Governors, Members of Parliament, members of the broad-based family, good afternoon. Your Excellency, I think I should have come before John Badi. It will be such an anticlimax, and I don't want to get you to sleep through my presentation, but I'll try. Your Excellency, and dear colleagues, you know, as a council leadership, we don't make news when we say anything positive about national government. The nature of the relationship that has been created over the last 14 or so years is such that the voice of the leadership of council can only be heard when they lament. So today I'll try not to lament and focus on what has been achieved as a result of collaboration and cooperation, what I call cooperative governance between the national and the county governments of the last 4 years. Please. Go ahead. Your Excellency, the greatest achievement over the last 4 years has not been what either level of government has accomplished independently, but what we have been able to achieve together. More than anything else, I can say we've been able to work together between the two levels of government, reduce friction, confrontation, and that allowed us to achieve a lot. Next. Your Excellency, this year marks 16 years since the promulgation of the Constitution, and about 13.5 years since devolution was actually institutionalized through the formation of county governments. Your Excellency, the data that I'm going to share here is from our open data portal at the Marifa Center of Council. At the Council, we have a team that tracks vital data, just like KNBS does, from counties, and at times there might be some slight differences here and there. Go ahead, please. It's in the area of health that this collaboration between counties and the national government is best evidenced. In 2023, we signed an IPA, an Intergovernmental Partnership Agreement with the national government. You're going too fast. The slide with the 100,000. Yeah, there. To set up the Community Health Workers Program. Before then, they used to be called Community Health Volunteers. Under this arrangement, we agreed to do a 50-50 co-funding between the national and county governments for CHPs to give them stipends of 5,000 shillings a month and to kit them. So the figure that we see there, the 100,000, is the numbers that were given kits, but the actual figure employed, I think, was in the region of 107,000. These CHPs have become a very critical COG in the delivery of health services because they're able to reach every village and ensure that there are a link between the health facilities and the communities. They've become very integral to our outreach programs in health. Your Excellency, the next thing is the the establishment and operationalization of SHA with all its segments. I know the figure that was quoted before me here was on 228 primary care networks. But according to the data we have, we actually have 277 established and PCNs across the country. What this does is that it has created stronger linkages between communities, primary healthcare facilities, referral services, providing thereby a more integrated platform for delivering healthcare closer to the citizens. As of June 30th, next slide, the number of people across all counties that are registered for SHA was in the region of 31 million. I know 2 months down the road that number could possibly have changed. And payments to healthcare facilities have now increased from an average of 12.7 billion to 21.36 billion that we take out of SHA for only public facilities within counties. Your Excellency, this has been coupled with the creation of what we call the FIF, the Facility Improvement Fund, because there is now constant money flowing every month from SHA to facilities, individual facilities. And much as once in a while we raise issues about delay of payment of claims, actually we're dealing with a positive challenge in our facilities, in that the facilities now have money. They think it's their personal money. Correct. The facility in charge at times will even tell the CEC, the Minister for Health, this is my money. And we have counties that have built entire wings of hospitals, such as Homa Bay, I know, out of FIF money. So this is a very good thing, because going forward, every facility in every corner of a county is assured of money, regardless of who the governor is. Your Excellency, they usually say the proof of the pudding is in the eating. All these interventions that have been made are for a purpose: to reduce infant mortality, maternal mortality, increase vaccination rates, increase skill delivery. So I'll just go into a few of those statistics. We have, with the national government, come up with what is called maternal and perinatal death surveillance and response program, MPDSR. This is to actively and consciously monitor which mother is dying in childbirth and which child is being lost in delivery. And the numbers have yielded results, and actually showing that in 2004-2005 fiscal year, there was 2,851 lives lost. That's the number of maternal deaths, compared to 2,656, showing a decrease of about 70%. These numbers, of course, need to come down further. One mother being lost, one child being lost is one too many. But you can see this trend of declining maternal deaths is as a result of the interventions being made in our healthcare systems, the reforms that we are collectively working together on. The number of licensed public facilities across the counties has also increased tremendously. And this data is available on the website, I guess, also of KPMDC. and this only speaks to public health, public facilities, from 4,500 under NHIF to a total of 6,740, an increase of 2,240 now registered under SHA. The number of hospital beds established across counties now stands at 10,104. And this includes, of course, ICU and HDU beds. Next, still in the area of health, when this administration came into office, the medical and service equipment scheme, I think it was commonly referred to as MESS, and I remember Senate saying MESS is a mess, had just lapsed. So the equipment was near obsolete with respect to the useful life, and there was no capacity to fund new equipment by counties. And so the idea of National Equipment Services Program, NESP, was conceptualized by this administration. NESP is now delivering equipment across all the counties, and at least 28 out of the 47 counties have received a number of equipments, including CT scans and MRIs, biochemistry machines, laparoscopic towers, and these are today available in nearly all the level 4 and level 5 hospitals, and for the blood and biochemistry machines even in level 2 and level 3 hospitals. The last cog in the wheel of that reform was the setup of the National Ambulance and Emergency Services, which was launched the other day, which will actually be reimbursing county ambulances for delivering patients to county hospitals. So the question of asking patients rather, to pay for fuel of ambulances or charging them for ambulance service will now be a thing of the past. Moving on, still within the health reform sector, as many as 42,000 digital devices have been deployed across level 2 to level 5 facilities, supporting the transition towards electronic patient records and digital processing of social health authority claims, making it easier also to collate health data because everything is now digital. So, Your Excellency, I think the one area where this collaboration in the last 4 years has really proved very advantageous to the counties and has really improved services to the common man is indeed in the area of health. Governors are usually quite protective of the health space because of the propaganda and the rumor that's always created that there's an attempt to roll it back. But I want to say that these things that we have achieved as demonstrated, and they may not be all the figures that you will require, will not have been achieved if we had not collaborated, from changing legislation to thinking through PPP arrangements for equipments, to the improvements that the administration has made in KEMSA, to programs such as MPDSR. Moving on, Your Excellency, the data of agriculture, I think what Honorable Mbadi gave is a lot more refined than what I'll give. The Council's data shows that, for instance, horticulture generated no less than 216.5 billion, up from 2003.6 billion in 2024. The amounts generated from coffee exports in 2025, for instance, just comparing 2 years, was up by 38.4 billion in 2024. And tea, according to our data, generated as much as 187.1 billion in 2025. Across all counties, food crop production has improved, with paddy rice output increasing from 169,300 tons to 180,000 tons, and maize deliveries slightly to 178,000 tons. And this is data that was all lifted from the last State of Devolution address that we had at the COG, showing that the programs that this administration has consciously thought of, such as the fertilizer program, are impacting on agriculture in all the counties. Your Excellency, agriculture's contribution to the national economy has, as a result, increased from, move a bit faster, 21.2% to 23.2% of GDP. And there are many programs that we run with the national government with respect to agriculture. These programs include, among others, the Food Security Resilience Program in the ASALs and the National Agricultural Value Chain Development in the more arable areas. Agriculture continues to demonstrate the transformative impact of this cooperative governance, and it's having an impact on our economy. Your Excellency, the CS also spoke to the issue of the fertilizer program. It is indeed having an impact, and county governments have expanded the agricultural network extension of services, irrigation development, livestock and market support to take advantage of the support that the national government is giving. With respect to fertilizer procurement, what the counties are reporting is 272,816 bags procured, reaching no less than 305,000 farmers. Both the national and county governments continue to provide certified seeds and seedlings. I remember CS Mbadi was asked about livestock, and he said that the milk data that he has speaks to livestock. I just want to add that across all the 47 counties, at least 6.1 million of livestock has been vaccinated in the period under review. County governments have expanded extension services to livestock farmers as well, reaching almost 2.5 million livestock farmers. Moving a bit faster. In the area of trade and industry, our work in counties begins with registering businesses and giving them permits. We report to Your Excellency that in this period of 4 years alone, county governments have issued over 1 million businesses with trade licenses, demonstrating growing business confidence in the country, because the 47 counties registering local businesses of 1 million actually speaks to the business environment there is. Working with the Ministry of Trade, we have 34 counties that are now developing industrial parks under the County Aggregation and Industrial Park CAIPS program, which program also is a collaborative program co-funded by the two levels of government on a 50-50 basis with respect to the construction. And governors have requested, Your Excellency, that the 13 counties that have not been funded so far, I think there's 13 counties that were worried that their funding has been removed in the last budget, that funding be restated, Your Excellency, in the supplementary, because I think this program now is picking up and all the counties don't want to be left behind. But we're working also with the Third Ministry to operationalize the ones that have been completed. And this program, Your Excellency, is probably the biggest investment in cottage industries since independence. In the area of climate change, the collaboration between the county governments and the national government is also bearing fruit. And here, Your Excellency, there is the financing locally led climate change flow action program across all the 47 counties. This has institutionalized climate governance and dedicated climate financing to the very, very local level, and its impact can be seen in terms of earth dams, in terms of incubation of agricultural farms in even places that are not traditionally crop producing areas. In the area of water, Your Excellency, the data that we have shows that the distances to save water has substantially reduced from 3.2 kilometers to 2.8 kilometers. This is largely because of investment projects such as the Kenya Water and Sanitation Investment Program, which the Ministry of Water is running with counties. Other programs include the Kenya Water Sanitation and Hygiene Program, KWASH. We also have underground water for ASALS, which is part of the Horn of Africa initiative. These, taken together with the investments that counties are putting in water, has resulted in a reduction of distances to save water. In the area of environment, Your Excellency, counties report that as many as 72.5 million trees have been planted in the last financial year alone across counties. Your Excellency, I've been asked to wind up, but please allow me, I just have a few more slides. The most contentious engagement we usually have, Your Excellency, between counties and national government is during the DORA process, which is counties always asking for more money. Equitable share has increased by more than 45 billion shillings in the last 4 years, and I think that was also demonstrated by CS Mbadi. Counties' own source revenue has also tripled, because the more counties get, the more they're also able to generate their own source revenue. But Your Excellency, more than the increase, I think the engagement has also become a lot more mature. Because this engagement usually begins at IBEC. And I remember, and I think my predecessor, Anne Waiguru, is probably in the room. Anne, I can see you there. Your Excellency, there's a time when during IBEC days, Anne will call me at 7:30 to call in sick. Because she was avoiding to engage with the chair of IBEC then. Now we have no attendance problems at IBEC. We're always there, and all governors attend. Because we have mature discussions under the chairmanship of His Excellency the Deputy President. Your Excellency, moving on to the general area of intergovernmental relations, the county governments and the national governments have in place at least 42 intergovernmental partnership agreements across all devolved services. We are represented in 32 boards, task forces, and committees, where of necessity, executives at the national and county governments have to meet. And this has sustained intergovernmental engagement and has secured full annual equitable assessments during the last 2 reporting cycles. Members of Parliament may not know that we are represented in boards such as SHA, such as the affordable housing, and this speaks to the collaboration that we have with the national government. Your Excellency, in the area of urban infrastructure and development, at least 200, please move on, at least 202 kilometers of roads have been constructed within 59 municipalities. This is under programs such as Kenya Urban Support Program, KUSUP, and Kenya Informal Sector Program. There has been development of at least 171 kilometers of non-motorized transport infrastructure, provision of 5,250 parking spaces for both private and public transport, construction of 192 kilometers of stormwater drains to mitigate flooding, establishment of 31 kilometers of sewer lines to improve sanitation, creation of 12 recreational facilities, development of at least 12 fire stations in different municipalities, 16 retail markets constructed by counties, 4,533 street lights installed with an additional 81-meter high mast lighting. This is in addition to all the markets and all the street lighting programs that have been undertaken by the affordable housing program in counties. And needless to say, Your Excellency, in many of our counties today, the biggest housing estates that are visible are indeed the affordable housing program houses. In the area of roads, we continue to partner with KURA in many of our sub-counties today. We're seeing tarmac road for the first time in many, many places. In fact, nearly all the constituency headquarters today can boast of some kilometers of tarmac. And for counties, we have at least 185,000 kilometers of roads that's maintained by the county governments. These are vital to link farmers to markets, children to schools, patients to health facilities. And Your Excellency will be glad if the issue of RMLF and the legal architecture around it can be completed so that there is harmony between members of parliament and the county governments. Please move on. I can see the mere mention of it is attracting some reaction. Let's move on. I think I've spoken to that as well. Just move on. In conclusion, Your Excellency, Your Excellency, and Your Excellency, in conclusion, I want to say this. As we've been told by my party chair, Gladys Wanga, down to 2027 has begun today. And Your Excellency, I began by saying that governors usually feel a bit shy, saying that, national government has done this and that. But I've also said before that as a council, we're not the official opposition. In any case, the official opposition today is ODM, and they're here with us. I think for this 1 year as governors, it would be fair that we speak more of the collaboration that we've had with the national government and what we've achieved with respect with that collaboration, and less of what we have not gotten or what we have through real perception been denied. Nearly all the governors in ODM and UDA are pro the broad-based government. We should take advantage of that. Your Excellency, your opponents, and we don't know who your opponent is as of now, one will try and use devolution and the strengthening and deepening of it as a promise for post-2027 elections. As the council, we feel that this has been the most pro-devolution government or administration there has been. And Your Excellency, I'm licensed to say that because I think I'm the governor who has served longest in the leadership of council, having served as 2 years, as vice chair for 2 years, and 2 years as chair of council. And I'm sure my sister Ahmed will agree with me. What we need to do, Your Excellency, then, I've not spoken to ECD, but there's much that we've done in the area of education. I just want to wind up because this gentleman keeps knocking on my door. What we need to do, Your Excellency, going forward, for the politics of things, and Gladys has spoken to us, is one, to speak at the mountaintops and everywhere, but two, to reduce cannibalization into each other. As UDA and ODM, and discuss the things that are likely to divide us in boardrooms rather than in rallies. And two, also, I don't see why ODM and UDA will take each other.
Let us have some order.
Let me go on.
No, everybody will have a chance.
I'm not talking about county governments and national government. I'm talking about UDA and ODM. I don't know whether ODM has taken UDA to court. I'm not aware. To Your Excellency, also, we need to reduce the so-called kingpin fights, especially in places where broad-based government has a lot of support. In fact, in those places, Your Excellency, what's likely to hurt us more is these kingpin fights than the opposition. Honorable Junet is pointing at Aaron Cheriot. Maybe I have had something else in mind. I want to end it there And honorable members of parliament, we are not party to the CDF case. No, please, we are not party to the CDF case. If a Kenyan joins us as COG, we have to send a lawyer to court. But we have no problem with CDF. We have absolutely no problem with CDF as Council of Governors. I think that debate is well behind us. Your Excellency, I want to assure you that as COG, family of broad-based, we will support you and will support